Hello, Alice.
Hi Lily.
You don't really look fine at all. What happened to you?
I'm not okay. I've been experiencing pain in the abdomen and there's blood in my stool for 15 days. I've visited a doctor and taken treatments, but nothing seems to work. Can you suggest a good doctor since you belong to the medical background?
Oh dear, you are saying that it has lasted for more than 15 days. Are there some other abnormalities that you have been observing?
Yes, I've been experiencing weakness and there is inconsistency in my stool. I either pass a watery stool or experience constipation.
Dr. Maria is a good friend of mine. Let me take you to visit her. Let's go inside.
Hi, how may I help you, Lily?
Hello, Dr. Maria. This is my friend Alice. Could you please check her?
Sure. What have you been experiencing, Alice?
I've been experiencing pain in the abdomen and there's blood in my stool for 15 days. I've been experiencing weakness and there's inconsistency in the stool. I either pass a watery stool or experience constipation.
I see. I suggest that we run an MRI. Dr. Sophia is a good radiologist. She will run an MRI.
Sure, Dr. Maria. Ellis, I will take you to the imaging room where I will run an MRI.
Okay.
Lily, I have run an MRI. Now I'm gonna hand over LAC reports to Dr. Maria. Could you please join us in the Dr. Maria's cabin so that we can discuss Ellie's situation?
Sure, Dr. Sophia.
I saw Alice's MRI reports and I have found that there is a growth of a tumor in the colon region of Alice's large intestine. To confirm if it is a cancerous or non-cancerous, we have to perform a biopsy.
Okay, Dr. Maria.
I have the results of Alice's biopsy. From what we know, the mass in the colon region appears to be cancerous. I can tell you that the tumor has become cancerous after a span of nearly 2 years. It was first a non cancerous mass, a polyp, which has advanced into cancer because it was not kept in check.
Oh no. Which state is it in, Dr. Maria?
It is a second stage cancer.
What treatment plan do you suggest?
I suggest that we perform a partial colectomy and if required, we will do adjuvant chemotherapy if the cancer has a higher risk of recurring. There is a growth of a tumor in the colon region of your large intestine. Alice, from what we know, it appears to be cancerous and it is curable.
Could you please tell me more about colon cancer and the treatment?
Of course, Dr. Jack, please explain the diagnosed case of colon cancer and our treatment plan to Alice and Lily in detail.
Okay, Dr. Maria, I will explain everything to them. Colon region of the large intestine is the final part of our digestive system, and colon cancer is a type of cancer that begins in the colon region. Colon cancer typically affects older adults, though it can happen at any stage. It usually begins as small, non cancerous clumps of cells called polyps that form on the inside of the colon. Over time, some of these polyps can become colon cancer. Polyps may be small and produce a few, if any, symptoms. For this reason, doctors recommend regular screening tests to help prevent colon cancer by identifying and removing polyps before they turn into cancer. The signs and symptoms of colon cancer includes a persistent change in your bowel habits, including diarrhea or constipation, or a change in the consistency of your stool, rectal bleeding or blood in your stool, persistent abnormal discomfort such as cramps, gas or pain, a feeling that your bowel doesn't empty completely, weakness or fatigue, and unexplained weight loss.
Do you know what might be the cause of colon cancer?
The clear cause of colon cancer are not known yet, but in general, colon cancer begins when healthy cells in the colon develop changes in their DNA. A cell's DNA contains a set of instructions that tell a cell what to do. Healthy cells grow and divide in an orderly way to keep your body functioning normally. But when a cell's DNA is damaged and becomes cancerous, cells continue to divide even when new cells are needed. As the new cells accumulate, they form a tumor. With time, cancer cells can grow to invade and destroy normal tissues nearby. And cancerous cells can travel to other parts of the body to form deposits there.
What is the treatment that you're going to follow to cure me?
If colon cancer develops, many treatments are available to help control it, including surgery, radiation therapy, and drug treatments such as chemotherapy, targeted therapy, and immunotherapy. You have second stage colon cancer. Many stage 2 colon cancers have grown through the wall of the colon and maybe into the nearby tissue, but they haven't spread to the lymph nodes. Partial colectomy, that is the surgery to remove the section of the colon containing the cancer, along with the nearby lymph nodes, may be the only treatment needed for now. In future, we might also test your tumor for specific changes called MSI or MMR to help decide if adjuvant chemotherapy would be helpful. But we may only recommend adjuvant chemotherapy only if your cancer has higher risk of recurring. We mostly recommend adjuvant chemotherapy considering the factors like cancer looks very abnormal when viewed closely in the lab, if the cancer had grown into nearby blood or lymph vessels, if cancer was found in or near the margin of the removed tissue, which means that some cancer may have left behind, if cancer had obstructed the colon, and if the cancer had caused a perforation in the wall of the colon. If chemo is used, the main options include 5-FU and leucovorin, oxaliplatin, and capecitabine, but other combination may also be used.
Thank you for clearing my doubts, doctor.
Don't worry, Alice, we are going to take good care of you.
The risk of colorectal cancer increases as people get older. Colorectal cancer can occur in young adults and teenagers, but majority of the colorectal cancer occurs in people older than 50. For colorectal cancer, the average age at the time of diagnosis for men is 68 and for women is 72. When colon cancer is caught and treated in stage 1, there is a 92% chance of survival at 5 years. Once the cancer is larger and has spread to the lymph nodes, however, the 5-year survival rate drops to between 53 to 89%, depending on the number of nodes involved. If the cancer has already spread to distant part of the body such as liver or lungs, the 5-year survival rate goes down to 11%.
In India, the annual incidence rates for colon cancer in men is 4.4 per 100,000 men, whereas it's 3.9 per 100,000 for women.
There's always hope beyond what you see. It's possible not just to survive, but to thrive and to live a healthy, wonderful life again. Cancer cannot cripple love, it cannot shatter hope, and it cannot conquer the spirit.